the number one issue that medical spas have is actually they get written up for sharps training.
Yes. I've seen that the OSHA, which sharps would fall under the OSHA compliance, they have the highest fines. Like I've seen fines anywhere from $2,000 to $5,000 to $7,000. And so it can be pretty hefty.
Hey, everybody. Welcome to the Medical Entrepreneur Podcast. We're so glad to have you today with a special guest, Amber Bechthold, who is here. And she is an expert on compliance and making sure that you are in your legal zone, making sure that everything is correct. Amber, could you tell us a little bit more about what you do and how you help medical entrepreneurs with their practices?
I typically have people that come to me needing compliance. They know somewhat of, hey, I need this in my office. So what I started off doing was guiding them and telling them what they needed. And then I quickly found out that it's not all in one place for you to go find out there in print, unfortunately. So I made it a point to actually build compliance out. So I make the actual binders, build them out, and deliver it to my clients. I walk them through it and help them understand, like, what is their medical director's responsibility? What is their responsibility?
Do you focus on kind of medical spas, or do you focus on all practices?
I primarily focus on doing medical spas. I have had some dermatology offices that I've worked with, as well as plastic surgeon's office, but they have the aesthetic component in their office. And so that's typically what I help with.
For a lot of us that are medical entrepreneurs, we get out, we're practicing, we think we kind of have things set up, but it's not very clear on the guidance or even like the state statutes, or sometimes confusing. I know that I've talked to attorneys before, and one attorney will say one thing, another attorney will say a different thing. And it seems like it's kind of like a gray area. What have you kind of found?
There's definitely that, those areas that are gray. And that's when I turn to my legal help and, have them, interpret and clarify things for me. So yeah, it's definitely not clear. Another reason why I wanted to offer this as a service, there are some, consultants out there that definitely offer compliance. My specialty is, again, building these binders out and not giving you a do-it-yourself project, because you start, searching and, looking on, you've got your governing entity. So you've got the Texas Medical Board website, you've got the TDLR website if you're doing lasers and esthetician services. And then you have your OSHA, your HIPAA that you have to be compliant with. And so again, it's just not all in one place. So not everybody knows that. They have some idea of like, oh, I know I need to be, OSHA certified. I know there's probably needs to be some component of HIPAA, but they just don't understand to what degree that these things need to be in their binders in office.
Absolutely. I know it's very confusing. And like, I saw a statistic the other day that was like the number one issue that medical spas have is actually they get written up for sharps training. It's like their primary problem.
Yes. And what I've seen and read, I use AmSpa for a lot of what I, kind of keep up with. It's kind of the hub for med spas and information. So I've seen that the OSHA, which sharps would fall under the OSHA compliance, they have the highest fines. Like I've seen in stories fines anywhere from $2,000 to $5,000 to $7,000, and so they can be pretty hefty.
Wow.
And then you go back to kind of Texas Medical Board and TDLR. I haven't seen fines, that high. So not to say that that it could never happen, but I've not seen those cases yet.
And so you feel that for the average, medical entrepreneur that they're kind of doing their own practice, they're starting their own med spa, something like this, what would be your advice to them in terms of, kind of like staying legal, making sure that they're on the right side of the law?
So definitely consulting with somebody that is very familiar with compliance in their state. Every state is obviously going to be different. I focus on Texas. And so I've made it just a point to, know as much as I can. And so that way, when my clients come to me, and have questions, I'm able to answer those. But I would definitely say focus on getting your compliance in place. They are actual physical binders that need to be in your office. There's, they need to be in a centralized location. And then, going back to like the medical director, the responsibilities, you've got to know what they're coming in for and what they're signing off on, because then you go into the component of not all medical directors know the responsibilities, because again, it's not just all in one place for them to to find out like, hey, these are my responsibilities, and it's just outlined. So you're pulling from different governing entities to combine that information so that your spa can be compliant.
Boy, that seems to be so true. I find that the medical directors are kind of like, some are either involved in the practice because they're working there, or the practice is like, part of their, like maybe they have like a nurse practitioner doing injections and they might be an OB-GYN, so they're in the same office. But it does seem that for a lot of people, their medical director is kind of not present, and many times they just come in once a month, that kind of thing.
Mm-hmm.
Does that put a lot of burden onto the actual practitioner themselves to make sure everything is documented and et cetera?
So I think it's important, and what I really kind of focus on when I do provide compliance to a client, I want them to understand, you're just as much as responsible as, the medical director is, because most of these medical directors, like you said, they come in once a month, or even if that, we can kind of talk about a case that was just recent in Frisco, where a provider was providing IV to a patient and the patient passed away. So that situation, the story stated that the medical director had actually never been in, and medical directors are supposed to be doing M&Ms, monthly meetings with the mid-levels. And so those things are supposed to be happening to prevent this. But in this case, the provider was an esthetician. She was not IV certified. She shouldn't have been doing this. She didn't have standing orders in place to be doing it. And so it was a very unfortunate situation. But again, why it's important to have compliance in place.
Wow, that's really scary even for the medical director as well, because, they didn't even have any orders, but it sounds like this esthetician thought that she's going to do IV services. And then when I read about that article, it's really horrible. They
Yeah.
basically tried to infuse TPN, or total parenteral nutrition, which is what you
It's
might use in
dangerous.
like a patient in the ICU or something who can't eat, And I
Yeah.
remember doing orders like that in my training, and like we would have to spend so much time calculating, what's the level of calcium, level of phosphorus, and I just think, here's a lady who probably doesn't even have any idea what that is, infusing that in someone's IV. And that's what I guess
Right.
killed the patient. It's really horrible.
I know. Yes. Very true.
But it goes to show you how important your job is to make sure everything is compliant, everything's documented.
Yes. And, I started doing this about 2.5 years ago. And when I started it, it was hard to sell compliance because there was no education out there that compliance was even an important aspect of owning, a med spa. Every medical facility, whether it's a doctor's office or a hospital, they have some sort of compliance. And in the same aspect, medical spas have to have that as well. And so now there's more talk about it, just in the industry itself, but I have a lot more people coming and buying, compliance and, hey, I didn't even know this was a thing, or hey, I'm about to open in 2 weeks and I didn't know I had to have this, but my injector friend that owns a med spa told me. And, there's that sense of panic, to get those things in place so that they can be compliant.
Are there any stories that you have that might give some examples of for people that are already maybe started their practice, or maybe they're about to start their practice?
I did work with a client in the South Lake area that was actually subpoenaed by the Texas Medical Board. And that case we worked on for 8 or 9 months. But what had happened was her subpoena said that she was practicing without a medical license. And so they required us to send documentations of her, all her records in her EMR system, and she had switched EMR systems. And so it was a tedious process, to say the least, but fortunately didn't get into too much trouble. Come to find out, there was just some hard feelings between the medical director and the client. And so, the medical director said, so-and-so is doing this and they shouldn't be. And it turned out to be, for my client, a good situation once it was over, because she didn't get fined. She didn't get anything. They told her, you're doing everything right. Your compliance is in place. They checked that. So yeah, she didn't get fined or anything. And she had just did compliance with us probably 3 or 4 months prior to getting subpoenaed. So they did check that. They did check her compliance. So yeah. So I'd hate to see what happened if she didn't have compliance in place.
Yeah, that's really true. And some of the stuff that I've seen just from like the medical board is, basically if you don't have your stuff in order, I've seen people have charges of essentially practicing medicine without a license, which is a felony.
that's what they came and told her, you're practicing medicine without a license. And, so then that's when they started checking different things. They were asking questions, and, we were able to, because she was working with me as her consultant, and we were able to make sure all her ducks were in a row, and, it turned out well. So we were pretty happy in the end.
Man, that's awesome. And
Yeah.
it goes to show you the power of having all that stuff documented and ready to go, because at any time, one of either somebody doesn't, it could be one of your employees doesn't like you, a competitor is angry at you, and then they file a report on you. Now you got to have everything.
You're absolutely right, because I've heard of secret shoppers, coming into, a competitor's spa, and you just never know what's going to happen. It's better to be safe than sorry, that you're already spending a lot of money by having a business, and to have those fines on top of all the expenses you already have as a business owner can be detrimental. So.
And are there any tips that you might give someone who's maybe they're already up and practicing, they're watching this video and they just realize, oh man, I think I'm in compliance, but I'm not really sure.
Yeah, absolutely. I would, always offer my services if you want me to overlook your compliance and then you're not local to the DFW area. We can set up a discovery call and I can check your compliance for you via Zoom. If you are local, I'm more than happy to set up something and come into your office to give you a quick overview of, hey, everything looks good, or you're missing quite a bit. And it's some cases we can, pop things in for people. In some cases, it's like, this is pretty old. Let's start new. And so it can go either way.
For the average, person who's practicing, aesthetics, is there any, I guess, how many regulatory bodies are essentially watching them, or, basically making sure they're in compliance?
It would be Texas Medical Board always, and then TDLR if you've got the components of you're doing chemical peels, facials, and laser hair removal. So that's, that would be TDLR, and then your OSHA for any business, and then your HIPAA compliance. So those are your four governing entities that they're overlooking to make sure that you're in compliance.
And so for the people that are maybe not in Texas, basically it's their medical board. They may have some kind of board that's related to cosmetology. Is that kind of what TDLs are? And then
yes,
they also have the OSHA and then in HIPAA, right?
Mm-hmm. Yes. For the most part, those are OSHA and HIPAA are pretty universal from what I've seen. I'm kind of dabbling in some California compliance and Oklahoma, and it seems to be that all of that's pretty universal.
So at least four different governing bodies over watching your practice,
Yeah.
Good to know. And then would you say that most of the time when clients or people that get into some kind of trouble, is the cause like an anonymous report? Is it something they did? Is it a patient?
Most of the time, it's honestly those secret shoppers. So those competitors that you move in that are not happy that you're offering some of the same services. It could be a competitor on social media that, oh, she said that, and I know she can't say that, and I'm not happy that, she's competing with me, and so he or she, and so they turn them in anonymously. So yeah, more anonymous, but your competitors for sure.
That's crazy. The penalties for these things, can be anything from mild to severe. Could you maybe talk about what could go wrong if you're not compliant?
The most extreme would be to lose your license. You go to school for all these years to, get your license. And then once it's gone, it's gone, and there's your livelihood. But I think also, your business being shut down, that's your livelihood. And so that can be pretty scary. And then just hefty fines, depending on who's coming in to do the audits, whether it's Texas Medical Board or whatever, they all have their own fines and fees that they will implement.
And then do you find that most of the people that are practicing or using your services, are they, physicians? Are they nurses, nurse practitioners?
The majority of them are RNs. They've come from the hospital setting and they're just kind of, burned out on that. Unfortunately, I feel like COVID changed a lot of things. And so we have a lot of entrepreneurs that are RNs starting their own business. And there are some nurse practitioners in that realm as well.
I think there's going to be more of that because from what I see, mainstream medicine already has a lot of problems. But if you look at it, it's the only industry that we've seen essentially reimbursement cuts for the last 30 years.
Right.
And yeah. I can tell you personally, like in specialties that I work in, you would get paid more for doing a procedure in 1991 than you do today. yet the power of your dollar is so much weaker, you know? So it's like the reimbursements keep going down, the amount of paperwork keeps going up, the stress level keeps going up, more patients, you know, and it just comes to a point where it just, you know, eats you alive. And I think that's why so many people are and we encourage people to escape mainstream medicine by starting their own thing, even if it's just part. Could you maybe answer, like, if someone is, you know, kind of like maybe they're still at the hospital, but they're trying to escape the mainstream medicine rat race. So they want to do some like mobile Botox, you know, as an easy way to kind of get their foot, you know, out, you know, get their foot in the door, so to speak, and start to build a client base. What would someone like that need to have in order to be compliant?
So they definitely need mobile compliance. They will need a certification from obviously whatever they're doing in office. If they're doing anything with TDLR, they're going to have a certification from them. Texas Medical Board does not require anything. However, they do require that even if you're offering mobile services, there has to be that component of the privacy. So, lots of people will do Botox parties or IV, mobile IV. There's, been many cases that I've read about where people are getting in trouble with that because there's no patient privacy. Everybody's in the room and you're talking about, the medical history of each patient in front of, all the people there. So if you're doing that, make sure that you're, making it, keeping in mind, you treat them like you do in your practice, closed doors, them only, and just, being mindful that there's other people listening.
Absolutely. And then what about, I guess, for example, people that are doing, kind of thing, like I've heard about people trying to start their own kind of practice in their house, like their own personal home.
I'm not quite sure how they do that, how they get around that. I've yet to figure that out because I know in working with the suppliers, Allergan, Galderma, MERS, all of them require that your ship to address be a business address. And they actually check that when they open your account. So how they're getting around that, I'm not quite sure. I don't personally think that it's a great idea, but I know that there are people doing it.
For sure. Yeah. I don't actually think it's legal because my understanding is that they have to be working in a place that's zoned medical, unless you're
Yes,
doing a
it's
mobile service.
right. Yeah. It has to be set up just like a medical office. And most of the time, it's not. So.
Absolutely. Is there anything that kind of everyone in the industry should be doing that they're not doing?
I mean, definitely making sure everything on the legal aspect is buttoned up in your clinic, making sure, obviously your compliance is there. And if it's not, reaching out to me or finding somebody that can do your compliance for you. You can do it on your own. You definitely can. I have talked to many people that have done it on their own. In fact, I've talked to a big injector in the South Lake area. She said that it took her anywhere from 8 to 10 months to kind of get everything together. So fortunately, I already have a database built. So when you come to me, I have a lot of the protocols and things already for things in the industry. So I can get them, to you pretty quickly.
And then is there anything that people are not doing now, but they should be doing to make sure that they're going to be okay with legal aspects?
Now that people are understanding that they need compliance in place, I think just understanding once that's in place, what are the responsibilities around that? So I outline that for my clients and tell them, okay, this is what the medical director is responsible for, and just kind of walk them through that. Make sure that they have all of those forms in their compliance binders, and just making sure they're keeping up with that, because I do read the Texas Medical Board website, pretty often. And I know some of the cases where doctors' licenses are suspended and things like that. It's because they're not signing off on 10% of their charts. They're not doing their monthly meetings, or they've never even step foot inside the clinic that they're overseeing. So definitely making sure those things are in order.
And then do you feel it's wise for medical directors to have some form of training or certification? Because it seems like most of them.
Absolutely.
Oh, thank you.
It's actually the law. And so the Texas Amendment, it's 193.17, I believe, states that the medical director has to have basic knowledge and training in everything that they're overseeing for a clinic. This is something that I feel is an issue in the industry because not all medical directors are doing that. I would say at least 90% of medical directors don't even have any kind of training. I've worked with clients, they're like, no, I need one that knows this, this, and this, and they can't find one. And so I definitely think that's an issue that, needs to be worked out.
What about, I guess one thing I saw a lot of was essentially kind of, you see kind of a setup where there's maybe a clinic owner who's usually not medical, and then they have, a nurse or a nurse practitioner, and they have a medical director that's essentially offsite. What do you say about having the clinic owner trying to direct the RNs and APRNs, and how might someone deal with that or make that, legal, I guess?
So definitely the standing orders have to be in place for each provider. I've worked with clinics that have nurse practitioners that are, very experienced in the field that they were previously in. And then they come over to aesthetics and they're like, oh no, I can delegate. And I'm like, actually you can't, because the law states that the delegation has to come from a doctor, like somebody that holds, an MD license or DO license. So making sure your standing orders are in place for each provider. So your esthetician, if she's offering any medical services, he or she, sorry, if they're offering any medical services, those have to be on the standing orders and things like that. Microneedling, medical grade chemical pills, those kind of things. And then, it also goes down to your RNs and your nurse practitioners have to have prescriptive authority in place. So I've been in many, many clinics where they don't have even anything for standing orders, prescriptive authority, nothing. So it's just, I don't think it's just well known in the industry still.
I think that's a great piece of advice. So basically, anybody who is not able, essentially, besides a doctor, you essentially need to have a standing order for every procedure and every single person that is going to do that procedure. Is that right?
Yes. And so I offer templates inside of the compliance that I do, and it has appropriate spots for all of that to be charted. So anything medical falls under the medical directorship for that clinic.
Gotcha.
And it has to be noted. Yeah.
This happens a lot where we see people that are maybe not medically trained, but they're doing, or they want to do, or they're trying to do medical procedures.
Mm-hmm.
Do you have anything in particular that you've come across regarding that?
So yes, actually, there's a lot of estheticians that are doing IV therapy, like the story we talked about earlier. They have to be IV certified, and it's up to the medical director to delegate that to them. I think that in reading what the Texas Medical Board, the rules and regulations around that, I think they kind of leave it up to the medical director to make those decisions if that's something they want to do, because ultimately it's their license on the line. So a lot of medical directors that I know, if it's not an RN, if it's not an NP, they will not delegate those kind of things. So for the most part, you have some, pretty ethical medical directors, but you're going to find your cases where they're not so ethical and they, just, sign off on anything, delegate and those kind of things. So.
And do you feel that, one of the things I hear a lot of is like people say, oh, I need to borrow your license, for my practice, that kind of thing. And every time I hear that, I kind of laugh, because it's like, if something bad happens, to a patient, that medical director is going to get it's going to get in the lawsuit. It's going to be drugged to the medical board. Like, it's not like you're going to be like scot-free. And I think a lot of people don't realize that just being a medical director inherently has some kind of risk or liability, especially if you don't have your things documented properly.
Yes, absolutely. And that's why, as time passes and the seasoned medical directors, they start raising their prices, because they understand, once they've got their feet wet and, have dealt with, cases and things like that, they understand the importance of their license and putting it on the line for these, these clinics. And so they raise their medical director fees because it's their license. So in the end, everything falls back on the medical directors. Yes, your esthetician or your RN might get a smack on the hand and a fine, but ultimately your medical director is the one that, is going to get the majority of whatever, fined or license suspended or whatever.
One of the things I also see a lot of is people saying, like there's been times where I've seen people that have medical directors that essentially they're not paying, or they try to do some kind of, fee splitting stuff where it's like, oh, well, as soon as I make profit, then I'll give you a percentage of my profits. Do you maybe talk about like, the proper way to set up your relationship with a medical director that's, would be considered compliant?
So Texas is definitely a CPOM state. So what that means is that the money that comes into your business has to funnel in and out a certain way. And I really can't speak on that just because it's a lot of legal jargon. but also your MSO, MSA has to be set up. So with Texas being a CPOM state, technically an RN or an NP cannot own a medical facility. So the law states that the doctor owns 51%, and then the rest goes to the owner, the other owner in the partnership. But there is a workaround to that. Again, it's the MSO, MSA. I can't speak a lot on that just because I've had it explained to me by Vertidato, who's a pretty big lawyer. They're pretty big in the industry. They know, their stuff. So I've actually asked them and they've explained it to me. And I'm like, you know what? I'm not even going to touch that with a 10-foot pole. So I always, refer to, talking to a lawyer or making sure, those things are set up. But definitely that is the law and that is what it states. Now I get a lot of clients that are like, oh gosh, what if they change the law, or what if they crack down on this? And, my personal feedback on that is, hey, do you remember 20 years back, I don't know, maybe it was 15, but when hospitals no longer allowed LVNs to work, if you weren't an RN, the LVNs had 2 years to go back and get their certification. And if they didn't, they wouldn't have a job. And so I feel like, I don't feel like they're going to come in and, definitely, just shut everybody down. I think that would be detrimental for the economy. So I do think there's going to be, some maybe grandfathering of things or something put into place where, they say, hey, we know that the majority of people are doing this, but you have until this time to get it right. So that's just kind of my personal take on, what I've seen and questions and networking and stuff that I've done with people in the industry. That's just my take on it. So.
Well, I think you have a really good point, because a lot of people are not set up legally right. The corporate practice of medicine states, I forget how many there are, but it's like a large number of the states in the US are corporate practice of medicine,
which is just 26 or 24, it's something. Yeah.
Yeah, it's pretty significant, And what I always find interesting is that people don't realize what that really means is that you need to have some form of corporation that is ideally owned by a physician or a physician company, where a physician, and depends on the state, has at least 51% ownership of the corporation. And that's where your money flows in for patient care. Once it flows into that company, then you can move that money to wherever you want to. You could go to a staffing company that you offer staffing services to. If you have an MSO, a master service organization, where you have a contract with that, and you say, hey, we're going to do all your management for you. And we're going to manage all the stuff for you. And you don't, which is quite common for physicians to have. Then you can do that, but it has to, you have to be legal and watch those money flows, because if you're not careful, you can get into a lot of trouble real fast, and then it causes a lot of damage, to something that you built.
Yeah, absolutely. And talking about, that, I think that it's better to have, especially with these nurses that are building a business and they want to do this long term, it's better to build your foundation correctly than to have to backtrack and untangle things. It just makes more sense to do things right in the beginning. You always tell your kids, do it right once, or you're going to have to do it again, in the same sense goes for your business as well.
Yeah, that's so true. Yeah. And then just out of curiosity, with your, because you've been working in this industry for a long time, it seems to me, and it's just as an outsider perspective, it seems like there's kind of waves of compliance that occur. So then you're kind of like, it's like a free for all. Everybody's doing weird stuff, and people are like, hey, you shouldn't do that. But, oh, my friend did this and nothing happened to them. And then something will happen, like you mentioned that event in Frisco, and then everybody is like under crackdown,
So I would say, don't do, again, going back to what we tell our kids, don't do what everybody's doing, because it doesn't mean that it's right. Just because, 90% of the med spas, are offering a service that you've heard, some talk about that may not be, the thing they should be doing. So I can talk about, semaglutide, for example. There was some commotion around that, and talking to my legal team, they talked about, advertising it appropriately, using the correct name, not the brand name if it's compounded, those kind of things. But also, there is no other RN ran clinics in the US besides med spas. And so going back to, they technically, you just have to be careful. I'll just say that you have to be careful. Just because, an RN clinic down the street is offering semaglutide doesn't mean that you should be doing it. And if you are, you really need to make sure that you have your ducks in a row, your emergency protocols, those kind of things, because with with the wave of that being the trend of what, weight loss is right now, I've heard of, some stories of people not taking care of themselves being on those medications and whatnot. So yeah, it can be pretty scary.
And then one of the things that I run into a lot is I don't think people have a lot of clarity around like the initial history and physical, or the like, because and for most medical spas, you need to have like a ideally like a history and physical on the patient once a year. You
Right.
sometimes just like review all their medications, make sure nothing's changed, make sure they don't have any diagnosis, that you weren't aware of.
Mm-hmm.
And usually that's done by, a physician or a nurse practitioner.
Right.
And then on the history and physical, they give a diagnosis, and that diagnosis is what activates the standing order. And so maybe could you talk about how someone who's maybe starting their own practice, can they make sure that they're always in compliance by using that model? Or is there something that you're seeing that people are not doing right?
This comes up a lot. As a provider, you're supposed to do a good faith exam, and it's good for 12 months. But you also need to be very mindful that your patient you haven't seen in a couple of months, you need to be asking those things. Has anything changed in your medical history? And not just that question, but going a little more in depth of like, do we add any new medications? And not just asking the question, but actually going through the list and saying, this is what I have, because they don't remember what they put on the list 2 or 3 months ago, those kind of things. But just being proactive so that you don't have to be reactive when, something happens, if something were to happen.
And then would you mind talking about the documentation that's required to stay in compliance? Because I find, especially with some of the people that maybe they're not in the medical industry, but now they're working in a med spa, so they might be like an esthetician. Before the esthetician got involved with medical services, their documentation for a facial didn't really ever happen. It was essentially an appointment in the calendar, and that's it.
Right, right. So definitely, as a owner, if you have staff, and you're bringing in an esthetician, and she's going to start providing medical services, you as her person, you need to make sure that you're educating them on that piece. And this is conversations that I have pretty often. Nurses, they feel like, I don't know that I'm charting, right. And so what I've kind of talked about with others in the community is overchart. You can never chart too much. I mean, you obviously have to be mindful of your time as a provider, but making sure that, because basically if it's not written and it's not in the chart, it didn't happen. And so, covering your rear end, basically, you don't want it to come down to, losing your license or getting, suspended or something like that. So just charting as much as you can, making sure you're doing that when it happens, because I know that I've worked with clinics that they'll jot down, notes in their phone or whatever, the provider, and then they try to go back and they forget. And so doing that daily, like you've got to do it at the end of the day if you're not doing it. If you don't have time to do it after each client, making sure you're doing that. So, yeah.
Well, that's a really good point. And I think you make a really good point there, because I feel like people in aesthetics, for whatever reason, just because the environment's different than a normal clinic, it's like all the stuff they learn just goes out the window. It's like, in mainstream medicine, you're going to do a procedure note, you're going to have a diagnosis, you're going to have the name of the procedure, you're going to have a consent, you're going to explain what you did, you're going to explain what happened after you did the procedure, like the patient going home, they're staying in the hospital, what's, disposition, like what's going on. And they'll have an aesthetic procedure that, maybe is arguably less complicated, but they'll have like a picture of someone's face with some, number of units written, but no detail as to, was the patient prepped? Was it, how did it go? Was there any complications? It's kind of amazing.
Yes. And, that brings kind of back to memory. I talked to somebody that had a reaction to a numbing cream, but when they went back to see what they had used, they had 2 different numbing creams in the office, and it wasn't written down to which one was used. So they really didn't know what the reaction was from. They knew it was probably from the numbing cream, but down to what you're cleaning their skin with, the numbing cream you're using, all those products you're putting on their face, listing all of that out is so, so important.
That's a great point, because I think that definitely is an area that we all need to improve on in the aesthetics industry too.
Yeah, for sure.
Amber, what would you say is like, some of the most frequently asked questions that people approach you with?
So the one that I get the most is, hey, I see that they're trying to pass a law where only nurse practitioners can inject. and I'm an RN, like, am I going to have to close my clinic? And what I say is, hey, it's not the first time, it's been over 10 to 15 years that has been brought before the board for nurse practitioners to inject in Texas and no longer RN. So, I tell them again, it goes back to that. I feel like there's going to be a grace period there if that, does happen. I think there are some other things they need to focus on in the industry, in my opinion, rather than those things, because RNs make great injectors. And so I don't feel like it needs to go to that level where it's only for nurse practitioners. Of course, that's my opinion, but you'll have a grace period if those things do come into play. The law is going to say, okay, you've got a year, 2 years, whatever to obtain that, or you can't own or inject or whatever.
I totally agree with you. I think RNs do make great injectors. And I think there might be, questionably, I'm going to say questionably, they might need a little bit more help kind of getting started, because perhaps as an APRN, they had more, advanced practice nurse may have more experience doing procedures and being more independent, that kind of thing. But even there's some APRNs that don't have experience with that. So kind of what I've found is just, even when we train a lot of students, I've been quite surprised that I don't find it's the degree that really like makes them a certain way, but it's their passion. Because I would pick somebody any day of the week that is passionate and really wants to do a good job and wants to learn and is watching videos on the internet and they're reviewing their training. And like that person will become a great injector. The person that, maybe is cocky and they think they know how to do everything already, that person usually doesn't do well,
Yeah, I definitely think you have to be coachable coming into this brand new, even though you may have been, an IC nurse for 15, 20 years. You've got to be open to the idea of being coachable, because what I've seen that's hard for providers to do is when they come from the medical setting, such as a hospital or a doctor's office, they have a kind of a hard time turning off that setting in their brain where, now it's the aesthetic side. And so things are just they're still medical, but they're different. Your clients are there because they want to be there. They're not there because they're sick. So it's definitely a more enjoyable field, I would say.
Oh, 100%. I think it's a little more enjoyable. And then I feel like the patients are happier. And I just remember, one time it was Jennifer, my wife was doing procedures for our aesthetics practice. And I was at the hospital doing procedures kind of for our mainstream medicine practice, And I remember I worked so hard on these procedures. And, like I think I worked on this one case, it was like 3 hours in the OR. And I got exposed to a ton of radiation. I had to take like a week off from any x-ray because of all the radiation. And at the end of the day, the guy's like, oh yeah, thanks. See you later. And that's kind of what I expected. And then she did, I think it was like a Botox and filler treatment. And the patient was like in tears, like in tears of joy, like how happy everything was, and like gave her a gift and all this stuff. And I thought, man, what a difference in the way, it's like, relatively the risk level is so much higher for what we call mainstream medicine. Your payback and reimbursement is a joke basically. And then you have the aesthetics practice where the patients actually want to be there. They're paying you with, good money that's not, it's not devalued by, constant cuts that happen. And then they're so grateful for the procedures. And there's nothing like that.
I agree 100%. I've been in the medical industry since I was in college, and I've always done, something medical. And I moved here about 7 years ago to the DFW area, and I wanted to work for a plastic surgeon. I applied. They put me in med spa. I didn't know anything about it, but I became very passionate about it pretty quickly. I was afraid of what my friends and family were going to think, because you think when you're not educated about the services that a med spa offers, it can seem a little vain. So I was worried about like what everybody would think. But then I quickly learned, with a plastic surgeon doing face lifts, nose jobs, breast lifts, those kind of things, like it's life-changing. And then people start to take care of other things, their skin, they go hand in hand. And so I definitely have become very passionate about it because it is life-changing. These services are definitely life-changing.
You're 100% right about that. I remember there was a case where a lady came in for treatment, and it was just, I think it was, combination treatment, like some filler, some neuromodulator, that kind of thing. And at the end, she was so happy she started crying. And I asked her, like, why are you crying? She was very happy with the results, but she said, for the first time in my life, I'm the pretty sister. because apparently all her life she'd had another sister, and that one was the pretty one. And so
Oh,
for whatever reason, now she could see herself as the pretty sister. And it was like a self realization that she had, that she was worthy enough to have praise and adoration and to be beautiful.
that's amazing.
You can do all sorts of stuff to people. You can put in pacemakers. You can, I'm not trying to downplay any stuff we do in mainstream medicine, but there is nothing that I've seen in mainstream medicine that makes an effect like that.
Absolutely. Yeah. Yeah. That's why I will never do anything else.
Well, I think you have a really great point. And then is there anything that you do regarding that?
Yes. So I definitely coach them through that. Needs to be part of their compliance that they have. Every medical director should have an emergency protocol. If they don't have an emergency protocol, you definitely you need to get one in place, because you never know. Just because it hasn't happened to you doesn't mean that it's not going to. I've heard of injectors that have been injecting for years, never had a vascular occlusion, anything like that. And, it happens, and then they don't have Hylenex in their office, or they don't have these emergency protocols. And so they're panicked. And, time is of the essence when vascular occlusions happen. And so you need to be able to review those things, have in mind on how they work. And so that when things like that do happen, you're like, oh, I know exactly what to do. So definitely working with your medical director to make sure you understand what their emergency protocol is. And if they aren't available for some reason, because most of them have primary jobs, that you have a backup physician that you can reach out to, a partner of some sort.
That's really true. And do you feel that it's wise for most people that are kind of starting their own practice? Like, a lot of people are almost intimidated to ask other people for help. Do you feel that it's like, really that intimidating, or do you think they should reach out more and build these kind of relationships?
So I've seen both. When I first started, I feel like it was a little more competitive than it is now. It's more saturated now with injectors, the area that we live in. But I think there are more people that are more injectors that are, happy to help if you were to reach out to them. I think it's just a matter of like finding your people, finding your network, and, really utilizing them to your advantage as a provider. There's Facebook groups. I know some nurses that have WhatsApp, a WhatsApp group, and, they communicate that way, bounce ideas off of each other. But yeah, just definitely doing something like that.
All right. So Amber, has there been any kind of new developments that you've seen happen in the industry?
So not really any new developments, but just something that it's kind of those waves that you talked about. Somebody says or finds out something, and it just kind of, goes through the industry. Some people know about this and some people don't. But if you offer laser hair removal, you have to have a second medical director. And I know this hits some people the wrong way. I post about it, and there's people that want to argue and stuff. And I'm like, I didn't make the law. I'm just sharing it. I'm educating it. I'm educating you, letting you know, that this is what the law states. And I have went to a lawyer and had it interpreted, and they came back and said, yes, that is definitely what it says. So basically, you have your primary medical director that oversees all of your medical services. So when we talk about medical services, it's anything that breaks the skin. So microneedling, IV therapy, obviously your injectables. But when we talk about laser hair removal, that is governed by TDLR. And they do require that not only your second medical director be within a 75-mile radius, but they also require you to have a second medical director. And it clearly states on their TDLR website that it cannot be the same as your primary physician. So if you want to go to TDLR and find where that information is, you can search laser hair removal at a glance is a good one. And it actually pulls up a document you can download and read on there. There's another one that is med spas at a glance. And I really like that one because it gives you a table and it breaks down who oversees what. So Texas Medical Board oversees this, Board of Nursing oversees this, TDLR oversees this. And I think one of the governing entities that I did not mention was Texas Health and Human Services. So they do oversee laser as well. So it kind of falls under their umbrella. Again, don't shoot the messenger. I just, want to educate and let people know that this is what happens, or this is what needs to happen. You have to have that second medical director. A lot of people don't want to hear that because then they have to pay a second medical director fee. They already are kind of like, gosh, I pay my primary medical director and I don't ever see him. He doesn't do a whole lot. And now you're telling me you have to pay another one. And so, there's that, but definitely, yes, you have to have one. So.
And I think that's a really great point, and definitely a gem, a pearl that you shared there. But it goes to show you, just once again, there's so many different governing bodies that are over you, and their rules like can overlap or be separate, just like that,
Yes, yes. And I'm continuously learning like all these things, like, just as soon as I feel like, hey, I am definitely expert in this, there's something else that I'm learning. The industry is, always changing. Things are always, rules, regulations are being updated constantly. And so I do my very best to provide, the latest and greatest to my clients when it comes to compliance.
So then basically, if you're a med spa and the med spa decides to work with you, then basically you're also making sure and like updating them about any changes that are occurring, because it seems like changes occur like so rapidly.
Yes. So it is a service that I offer. You can, package and bundle some things together. And if that's one of the services you want to do, I offer, keeping you compliant for 6 months or keeping you compliant for the year. And so I give a discount if you bundle that together when you purchase compliance from me. I just basically, if you're not local and I can't come in and do it myself, I'll email you the document and tell you where to put it in your compliance, and you just pop it in there and you're good to go.
Well, that's awesome. Any other things you want to share?
I think we hit pretty much everything.
Well, thank you so much for coming on, Amber. We really appreciate it and sharing your expertise. And if somebody wants to find out more of, how they can get in compliance and reach out to you, where should they go?
So info@aestheticbc.com is my email. Aesthetic Business Consulting is my Instagram handle. And so you can text me also. I can give you my phone number, 817-629-2188. And I'll be happy to help. We can set up a discovery call and kind of talk about what you're needing and go from there.
All right, perfect.